Hello, welcome to Courageous Doctors, the new show for you and your doctor. On this show, we'll deal with Obamacare updates, we'll look at other healthcare events, and even talk about health and safety tips. Now let's begin. According to the Star-Ledger, the Robert Wood Johnson Foundation is seeing a drop in the uninsured in New Jersey. 162,000 have signed up for the private insurance on the federal exchanges, and 140,000 have signed up for Medicaid. Now remember that the next sign up for Obamacare is November 15th. According to the New York Times, there will be an automatic re-enrollment unless there was a change in your income, or you had unreported taxes on the exchange, or the insurance company that was on your exchange has dropped out of the exchange. Star-Ledger says that 2 million enrollees may have to repay their subsidy due to government records not matching their income, their immigration status, and the government is asking those involved to please answer your questionnaires when they send it so that they can correct the computer record and you don't have to repay your subsidy. Roll call says that 2.9 million Medicaid applications are still not processed. The Wall Street Journal says that we're still having trouble with increase in emergency room rates that were supposed to go down by ensuring Obamacare, but apparently patients signing up for Obamacare, especially the Medicaid, still haven't found private physicians. The Hill reports that Senator Jay Rockefeller introduced a bill to fund the CHIP program, to extend it. You know, that's the Kids Care or Children's Insurance. And he wants to extend it until 2019. The CHIP program would affect 8 million children. USA Today reports that according to AFLAC, employees face higher insurance premiums and copays. When faced with unexpected medical expense, they then have to borrow from their 401k retirement plans or use their credit cards. Associated Press says that insurance companies are calling for cheaper catastrophic plans to entice the youth into the market. Time reports a moneyrates.com survey shows that 40% of participants did not put money away for retirement health expenses. Remember that the cost of a semi-private room in a nursing home can be $81,000 or more per year. The Medical Society of New Jersey is supporting regulation on how insurance companies are using the gift cards or virtual credit cards. This way, patients don't have to pay money out of their pocket. They just use the insurance card. However, the Medical Society wants physicians to have the right to refuse these cards.
Hi, my name is Marla Gruber, holistic health coach, smile expert, founder of the WIN program for children, a yogi trainee, and a mom to 2 teenage children. I'm excited to introduce into Dr. Barry's office my services of increasing your child's positive energy. My goal is to get the body comfortable so it can function at its full potential, enabling them to smile from the inside out daily. I will help both you and your child understand that being healthy is not just an absence of disease, it's having vitality. I believe that life is a journey, not a destination. I will help you enjoy the process of guiding your child to living a better quality of life and being the best that they can be. I look forward to helping you. Thank you for listening and keep smiling.
Hi, I'm Ingrid Burke.
And I'm Gina Unger.
Gina has known Dr. Barry in a professional and personal capacity for many years, and we are thrilled to be in his building. We are psychotherapists and we offer mental health counseling for ages 12 and up. We do individual, couples, and family counseling. We're also excited to say that we have groups that we have for teenage boys and girls for social skills, anger management, and self-esteem building. If you need to reach us,
check us out at lifeworksnj.com.
Our phone numbers are also listed on that website if you'd like to contact us. Thank you.
Thank you.
Now let's turn to other healthcare updates. The Associated Press gives us an update on the MERS epidemic, the Middle East Respiratory Syndrome. This illness kills 1 out of every 3 patients, but apparently We've only had a couple of cases come to this country and there was no spread. Until this time, there continues to be cases occurring in the Middle East, and travel to that area, you should be cautious. The Center for Disease Control has now confirmed 288 cases of measles this year, and it is spread over 18 states. All children should be vaccinated. Remember that there is a 1 out of 500 chance of a child dying if unvaccinated. Reuters reports that Florida confirms 24 cases of dengue fever and 18 cases of chikungunya disease. Both are mosquito-borne. They cause high fevers, flu-like illnesses. Chikungunya has severe joint pains, and all cases have been in travelers to the Caribbean and to South America. California confirmed a pertussis epidemic. It is now up to over 4,500 cases. 1,100 alone were seen last month. 142 were hospitalized, mostly in infants under 4 months old. Other western states are also reporting pertussis or whooping cough as well. There has been a massive recall of ground beef infected by E. coli, 11 cases reported so far in over 4 states. Reuters reports that salmonella has infected chicken from the Foster farms, and they've been recalled. The Center for Disease Control reports that 1 out of every 5 food handlers is actually sick and cooking your food. The Hill reports that the Center for Disease Control Director, Tom Frieden, is asking Congress for $30 million to help hospitals track antibiotic-resistant drugs. USA Today shows that the veterans' hospitals are not staffed to handle all of the soldiers returning home from war with PTSD, post-traumatic stress disorder. This was according to an Institute of Medicine report. This comes at a time when Congress is investigating the general wait times, which can be months to years for entry into the VA, as well as the cover-up scandal that was hiding a lack of staff. NPR says that there still remains a shortage of IV saline solutions, and it might be till next year before we're out of that shortage. Center for Disease Control reports that 86 workers in their lab were exposed to anthrax. All are healthy and have been placed on preventative antibiotics. Wall Street Journal says that the Federal Drug Administration has approved an inhaled insulin with the caveat that it is not to be used by those with lung disease such as asthma. Let's move on now to health safety tips. Arsenic has been detected in rice products, juice, and beer, and you should go to the Federal Drug Administration, the FDA website, for product information. Bloomberg News shows that the government is investigating deaths in oil field workers related to hydraulic fracking. The Star Ledger shows that the Bloomberg News shows that the government is investigating deaths in oil field workers related to hydraulic fracking. The Star Ledger shows that New Jersey Transit has posted on its website an emergency management plan. This is for bus and rail during storms and catastrophic events. The Boston Globe shows that the FDA, Federal Drug Administration, warns that testosterone products may increase the risk of blood clots. You should check with your physician before using them. New York Times shows that the FDA chief, Margaret Hamburg, traveled to India regarding safety concerns in the generic drug market. 80% of generic drugs are imported. Ending on a good note, NPR says that cruciferous vegetables like broccoli, kale, and cabbage help to detoxify our gastrointestinal system, as well as support the healthy bacteria within us. We have included here an article on organic food labeling. Star Ledger has reported that the president has asked for maternal paid sick leave. Now, California and New Jersey are one of the two states that at least have partial paid sick leave. He also is holding forums on working families. I would like now to show you an interview that I had with Ed Correa from Working Families United, as Ed has supported the Assembly and Senate bills on paid sick leave this year, and this is for non-government workers, and I want to show you that the campaign has now been launched. Take a look. Gee, Ed, it's so nice to have you here on this news show. I'm so excited about this. Tell me, how's it going with the Senator's campaign for the paid sick leave bill?
Doctor, thank you for having me on the program. It's an honor to be here. Yes, we are launching the statewide campaign for earned sick days on June 16. We're very excited about it. We helped and educated the community in New Jersey to vote for the minimum wage, and we are honored to lead this campaign for earned sick days. 1.2 million workers in the state of New Jersey will benefit from this policy. It's good for business, it's good for the community, it's good for workers.
Gee, that's so exciting. Tell me something. What do my viewers do? Like, if my viewers represent a large organization, like a service club, like Rotary Club or Women's Club or PTAs, how can they get involved? What should they do?
There are many ways to get involved in this campaign. It's going to be a one-year-long campaign, we estimate, and we hope to give a final bill to the governor's desk by next year. Many ways to get involved. First, take action to call your legislator, your local legislators and senators and assemblymen, and urge them to co-sponsor the bills, both the Senate version and the Assembly version. The other way to get involved is to join as an organization, join the Working Families United Coalition as an organization. And there are many ways to take action with the membership, through postcard signing, to holding events, to inviting us from Working Families United to speak before your membership and your constituents.
Oh, gee, Ed, that's terrific. Let me ask you one more question. You know, some people are kind of shy about speaking out publicly. What if they feel so strongly about this law, but they just want to do something privately with you? How do they do that?
Sure, that's another way to take action, and is for individuals to sign on to the website and get emails from us and share those emails with family members. Spread the word. Download the resource kit. We have a toolkit with graphics, with fact sheets that they can pass it on to other people and educate them about the need to workers in New Jersey to have earned sick days. Another way is to go to our website and take actions. We have many actions to take. They can also volunteer in our campaigns. We're going to be phone banking legislators. We're going to be doing lobby days. They can come down to Trenton where we hold our lobby days in Trenton, and they can help us lobby. Together we can make this happen.
Yeah, this is terrific. This is exciting. Listen, good luck to you, and I hope we can be a part of this campaign.
Thank you, Doctor. Thank you for your time, and thank you for having me.
My pleasure. I would like to end this news hour by giving my personal opinion about paid sick leave. I would like everyone to carefully look at Assemblywoman Lampert as well as the Senate component bill and really think about whether you want to support paid sick leave. My own personal feeling is it's the right of all of us in New Jersey to be able to go to our physicians without having to be afraid of missing work or losing pay at work and having to stay up all night in the emergency room. And this is whether we're caring for ourselves, our child, maybe an older parent. And so seriously look at this bill. The actual information shows that it doesn't really cost the employer that much to give you up to 4 or 5 paid sick days a year. And I think it'll give us a healthier workforce. We mentioned earlier that 1 out of every 5 workers that's handling your food is actually sick, and they don't get sick pay and they can't get off. It's just basically healthy for all of us to be able to go to our doctor. With that, I'd like to thank you for watching this news show, and we look forward to seeing you next month.
Hi, I'm Randy Lupo, host of The Randy Lupo Show on Broadband Box Office. Wait, is that a tongue twister or an alliteration? Come meet my favorite people, comedians, actors, writers, spiritual people, and everyone in between. I'm looking forward to seeing you.
It's the Mark Daisy Show, filled with gifts, fun, and surprises, and $20,000 in cash for every viewer. Well, maybe not. But we do talk about stuff and things that you might want to think about after, before, and during the show. It's engaging, at least. So come by, won't you? We're here at Facebook, on iTunes. We broadcast from VK Media right here on the East Coast, and we're part of broadbandboxoffice.com. Check us out, come by, like us, do what you can, spend some time, take some time off, sit down, have a viewing. It's happening, it's now, it's controversial, or maybe not. But we could use a couple of more viewers, maybe starting with you. Won't you?
Hi, my name is Tom Ragu of the Tom Ragu Sit Down Comedy Show. You can listen to us at the Broadband Box Office, and for more information, please visit www.tomragu.com/podcast.
Hi, everybody. How are you? I'm Bob Gonzo of The Bob Gonzo Show, and I'm here to introduce The Bob Gonzo Show to you. Watch The Bob Gonzo Show on ComedyMondays.com and iTunes. Once again, ComedyMondays.com and iTunes. Watch it live, or you can watch it on the archives, which means you can watch it forever. Bob Gonzo is the greatest show on the internet right now. It's the funniest, it's the sweetest, it's endearing. We have stand-up comics, we have bands, we have actors, we have people in the fashion industry. We have everything you need. So once again, The Bob Gonzo Show, the greatest show in the world. And if you watch it, you will become a better and happier and sweeter person. You. Watch The Bob Gonzo Show, everybody. Thank you very much. Thank you.